Hi, Dr. Mancini here. I had a question posed to me that I think is an important question to answer for more people. And that question is, how do you know acupuncture is helping? Well, first of all, right off the bat, majority of the patients we see and majority of patients I've seen over the past 25 plus years, it's pretty obvious. They feel pain relief, they have better function, overall improvement. So that's a moot point for those folks because it's pretty obvious. The question is posed for folks that come in with more chronic conditions, and most often what we see is chronic pain. So the question is, how do you know acupuncture is helping in these cases when you may not see the immediate pain relief effect? In fact, a lot of the doctors who refer to us, and over 90% of the folks that come to us are from medical doctors, these doctors don't refer to us just to get out of pain, because if that was the case, they would just give them more medication. So they refer to us because they know that we're going to start digging deeper. And to dig deeper means to understand that chronic pain is like the tip of the iceberg. Below that tip is the big, what I call amplifiers to chronic pain in this case. And what you need to understand is that acupuncture doesn't just treat the local effect, it treats the systemic effect, which means it helps activate the body's natural restorative systems, the body's natural repair systems, the body's natural recuperative and systems that optimize health, growth, and restoration, called the parasympathetic nervous system. I know it's a bunch of words I just threw at you, but at the end of the day, what we're trying to do is we're trying to reboot the body's entire self-repair system and not just focus on the area of pain, because if we do that, we're doing what everyone else is doing and the patient's still in chronic pain. So the reason why they're referred to us is because we dig deeper. We look at the other amplifiers like diet, lifestyle, exercise, nutrition, emotional state, a big one, a person's state of emotions, or what we call autonomic nervous system state, will determine how well they respond. If they're in chronic states of anxiety or uneasiness or panic, or if they're in chronic states of depression or low energy or low motivation, these high and low states have a very direct impact on one's capacity to heal or get out of chronic pain. So what we do and what acupuncture does for those folks is it starts to improve the areas outside of the area they're coming in for. So the answer to your question, how do we know acupuncture is helping? Simple. Look at other areas outside of your initial complaint and look at those areas like your quality of sleep, your energy, your emotional state. Is your mood starting to shift? Are you feeling more relaxed? Are you noticing that you're not maybe overreacting? Are you noticing that your energy is up a little bit in the morning? Are you noticing that you can move a little bit better, not just in the area of the problem, but just overall mobility? So these are the things that you're going to look at to know if acupuncture is helping, okay? Hopefully that answers the short question with the long answer. Take care.